So we are really preparing for the big day. The big day is going to be literally in a few hours. I have to be at the hospital at 8 in the morning. As you can see, I have removed my brace, and the reason I have removed my brace is because I want to wash my hair thoroughly, just because I'm not going to be able to wash it for a minute. But what I'm going to be doing now is I'm going to be showing you how I pack for my surgery. So there are a few things that I'm going to do. So the surgery is going to take about 2 hours. And one of the things that I am going to do is I'm going to show you specifically how I pack for my cochlear implant surgery. So number one, you want to be able to have all of these things obviously ready and in your go bag, so that tomorrow, the morning of the procedure, I am able to kind of just like grab these things and just go. I don't want to be packing the day of the procedure, especially because my procedure is going to be very early in the morning. I have to be in the hospital at 7, which means I have to be out of the house by 6 in the morning to just really give myself enough time, deal with the snow, deal with traffic, and just really have the most stress-free day tomorrow. So let me show you what I'm going to be packing. So first thing is I am going to be packing a comfortable pair of pajamas. Now, I picked this pajamas because, and I've talked about this before, they have the buttons in the front of the pajama. So I am going to be able to undress, put them back on easily. You do not want to be doing this like up and down after surgery. You want to make it accessible so that you're not screwing anything up or moving things around. I know my head is going to be very tender, so this is going to be number one thing you want to pack. I am going to be going to the hospital tomorrow, obviously in winter clothing, like layers and jeans, but once I get to the hospital, I am going to change into my pajamas. You also want to be able to have a comfortable pair of bras, like a comfortable bra. I'm going to be wearing this tomorrow because obviously you don't want to be like tomorrow in the surgery room, so just something with a little bit of padding to get you comfortable. Then, a nice pair of clean underwear, just, ready to go. As usual, I prefer my little black underwear. I also talked about having nice fluffy socks. So you want to be able to have nice fluffy socks that provide insulation. I particularly like these because I get very, very cold in hospitals. I just get very cold. So these are going to be particularly useful for me in the room. So these are going to be non-negotiable things that I need to pack with me to the surgery. In addition to that, it is an outpatient procedure, meaning you're going to go in, you're going to get your procedure, and you're going to get out. However, it is always important to plan for the unexpected. The worst thing that can happen is that you have any sort of complication. You have to do like an overnight, and you're not prepared for that. So whenever I'm going in for any sort of medical procedure, I always like to pack just in case I'm going to be staying an extra night. So I am obviously packing an extra pair of underwear. You don't know if you have an accident or in the emergency room, so I'm just packing like 2 extra pairs of underwear. I do not go for sexy underwear during my surgery, like I'm going for comfort. I also like to bring an extra bra, just, for comfort. And an extra pair of pants, just in case, like, you don't know what could happen, like, you got your period, like, right after the procedure, like, so many things can happen, so just having an extra pair of pants. Now, I brought this sweater. Again, you want to be able to have something that is going to be accessible, that you can easily remove, unbutton. You don't want to be going up and down. But I bought this because it's kind of like stretched out at the top. So it's going to be okay for me to kind of like go in and out from this. So I just bought this extra pajama just as an extra. And then finally I have this robe. It's a black robe, just like any other black robe. I got this at Uniqlo. It's my favorite robe in the world. It's so fussy and warm, and it's just so comfortable. So I'm going to be bringing this with me for the waiting room area. So let's go ahead and just put everything in the bag. Of course, I'm going to put the backup. Whoops. Of course, I'm going to put the backup stuff all the way at the bottom. So, extra t-shirt and extra pant all the way at the bottom. And then the things I'm going to be changing into, they're going to go all the way at the top. So these are all things that I'm going to be changing into as soon as I get into my bed right before the surgery. And then I'm going to have my robe. Let's hold it up. And I'm also bringing with me just something to keep me occupied. I've recently picked up this copy of the $100 Startup by Chris Guillebeau, which has been recommended to me for a minute. So I've read just a few pages, but it's just something to keep me occupied while I wait to be discharged. So I'm gonna put that in here and ready. Hold on. And that's pretty much it. And my bag is ready to go. In addition to that, tomorrow I'm going to be packing my batteries. And what else? My phone, my tripod. That's pretty much it. It's 3:30 p.m. I'm not going to be eating anymore for the rest of the day. I had my last meal at around noon, so I'm done with food for the rest of the day. I'm just going to have water, but I'm not allowed to have water past midnight. So I'm just going to have just drink as much water as possible. I'm not allowed to have snacks or anything in my stomach anymore for the rest of the day, just because eating can cause complications for the anesthesia. We don't want that. So that's pretty much it for packing. I'll keep you guys updated as we go through the process. But yeah, my bag is done. Packing is done. I'm going to spend the rest of the night just really doing chill activities like painting, watching Netflix, reading my book, and just taking a chill. And then tomorrow, 6 in the morning, wake up, pack up, and leave and be in the hospital by 7 in the morning. Woo! So go light a candle, go pray, go do whatever it is, whatever thing you believe in, and I'll keep you guys updated tomorrow. Alright? See you guys on the other side.